I'm Marcellina Mian. I'm a pediatrician, Associate Dean for Medical Education at Weill Cornell Medicine, and this is my 10th year here in Qatar. Infants who are not yet walking, who are not yet ambulatory, who are not yet sitting up on their own, are not going to be moving much, and so it's less likely that they will be injured. And a parent would know, or a caregiver would know, if the child had gotten some injury. Important to start thinking about a possible injury if the child is ambulatory, or even with an infant if the parent has not been with the child for a period of time. So may have been with another caregiver, and that caregiver may not have wanted to tell the parent, I dropped the child or the child fell. And so it would be important to check the child's limbs, check for any signs of bruising or swelling, or if it feels funny. If there's a broken bone, then you get a feeling as if rustling of leaves. And clearly the child would be tender in the site of injury. Or feeling around the head to see if there are any lumps or bumps that might be explain why the child is crying. Finally, there are times when we just can't figure out why a child is crying. There is what is often referred to as colic. And colic is just a word. It just tells us the child is crying, and we as adults can't figure out why. And that can go on for quite some time. Typically, it's in children 2 to 6 months of age, typically around the evening time. May go on for 20 minutes, may go on for an hour, may go on for several hours. And some children crying most of the hours of the day drives a parent crazy. And the important thing is, in fact, to stay calm. If you've done everything you can, if you've checked that the child is not hungry, that the child is not cold, the child is not hot, the child is not injured, does not have a fever, seems well, then the important thing is to keep yourself calm. Keep yourself from getting frustrated so that you don't react in anger. Because the worst thing you can do is hit back at your child or shake him because you're so angry. And that will injure your child. Walk around with him, see if that soothes him or comforts him. If it doesn't, put him down, make sure he's in a safe environment, and walk away. Have a cup of tea, have a hot bath, put on your favorite record, walk out the door. Obviously don't go too far, but don't stay behind and get frustrated. The important thing is to recognize when your child is sick. When your child is sick, take him to a doctor to be checked. Otherwise, realize that it's normal for children to cry, and do the best you can with it. The important thing is keeping a child well and healthy and having a safe childhood.